So the LOXO-RAS-20001 study is a study that's looking at the use of a checkpoint inhibitor, Pembrolizumab, as well as Olomorasib, a second-generation KRAS G12C drug. The rationale for this is we know there's a lot of G12C drugs already out there for the second line, but the durability response and responses are limited. So the hope is that with a new generation of drugs, we can move them up into the frontline setting. And to do that, we believe it's best to combine with a checkpoint inhibitor. This is updated data on 48 patients looking at safety, tolerability, and of course, efficacy as well. In terms of efficacy, the clinical benefit rate is over 90% in patients with a PDL high score, and nearly that as well in all patient population. That tells us that this combination clearly does have evidence of efficacy superior to what we've seen before in the second line setting. So this is updated data based upon some new data cuts that we're seeing. Most importantly, what we found in this clinical study is that it appears to be tolerable. The concern with the previous generation of drugs has been GI side effects, so diarrhea, as well as hepatotoxicity, elevated AST and ALT. And there was some minimal evidence of that, mostly grade 1, grade 2, some grade 3. Very few patients had to discontinue the combination due to elevated liver function tests with this drug, so it tells us that you could administer them together. And the level of elevation appears to be relatively modest and able to be modified very well, either with dose holds or steroids. Interestingly, the labels have been updated with Pembrolizumab, so we believe as we go forward that the number of dose reductions would actually be a little bit less. We're combining two drugs, so in this phase 1 study, we have to be a little bit more tight. But given that we have a good safety profile, we think it'll be easier to combine these in the future. So this tells us the preliminary data is incredibly promising in the frontline setting. And then you can give these drugs and they can work very well, both in an all-comer population, but also very specifically a high PDL score greater than 50% population for patients with lung cancer.